Ebola virus disease, or EVD, is a serious health problem. It is caused by the Ebola virus, which belongs to the family Filoviridae. The disease was first identified in 1976 near the Ebola River in what is now the Democratic Republic of Congo. Since then, there have been multiple outbreaks, primarily in Africa, but the virus has the potential to spread globally. EVD can cause severe illness and even death. The virus attacks the body's immune system and organs, leading to symptoms such as fever, severe headache, muscle pain, and unexplained bleeding or bruising. In many cases, the disease progresses rapidly, and without prompt medical intervention, it can be fatal. This essay will teach you about EVD. We will delve into the history of the virus, its biological characteristics, and the various ways it can be transmitted from one person to another. Understanding these aspects is crucial for both preventing and managing outbreaks. We'll cover how it spreads, its symptoms, and how it's diagnosed. The Ebola virus is primarily spread through direct contact with the blood, body fluids, and tissues of infected animals or people. It can also be transmitted through contaminated objects such as needles and syringes. We'll also talk about treatment and prevention. Currently, there is no specific cure for EVD, but supportive care such as rehydration and treatment of specific symptoms can improve survival rates. Experimental treatments and vaccines are also being developed and have shown promise in recent outbreaks. Ebola outbreaks can be scary, so it's important to have accurate information. Misinformation and fear can lead to panic and stigmatization of affected individuals and communities. By staying informed and following public health guidelines, we can help control the spread of the virus. This essay will give you the facts about EVD. We will provide detailed information on the latest research, statistics on past outbreaks, and insights from medical experts. Our goal is to equip you with the knowledge you need to understand and respond to this serious health threat. Understanding EVD is crucial for protecting yourself and your community. By learning about the virus, its transmission, and prevention methods, you can take proactive steps to reduce the risk of infection. Community education and awareness are key components in the fight against Ebola. We'll explain the science behind EVD in simple terms. This includes how the virus replicates, how it affects the human body, and the immune response it triggers. Understanding the science can demystify the disease and help you grasp why certain measures are necessary to control its spread. This way, everyone can understand this important health issue. Whether you are a student, a healthcare professional, or a concerned citizen, having a clear and accurate understanding of EVD is essential. Knowledge empowers us to make informed decisions and take appropriate actions. By learning about EVD, you can help prevent its spread. Simple actions, such as practicing good hygiene, avoiding contact with infected individuals, and supporting public health initiatives, can make a significant difference. Together we can work towards a future where Ebola is no longer a threat. Ebola is a zoonotic disease, which means it can spread from animals to humans. This transmission is a significant concern because it can lead to severe outbreaks among human populations. Zoonotic diseases are not uncommon, and they include other well-known illnesses like rabies, Lyme disease, and certain strains of influenza. The interaction between humans and animals, especially in areas where wildlife is abundant, increases the risk of these diseases spreading. The Ebola virus is part of the Filoviridae family, a group of viruses that can cause severe hemorrhagic fevers in humans and non-human primates. These viruses are characterized by their filamentous structure and their ability to cause high mortality rates. There are several different strains of the Ebola virus, each with varying degrees of lethality. The most well-known strains include Zaire Ebola virus, Sudan Ebola virus, and Bundibugyo Ebola virus. The Zaire Ebola virus is the most dangerous strain, responsible for the largest and deadliest outbreaks in history. It has a high fatality rate, often exceeding 50%, and can spread rapidly in affected communities. Major outbreaks of Ebola have occurred primarily in West and Central Africa, with the most notable one being the 2014 to 2016 West Africa outbreak, which claimed thousands of lives and highlighted the need for better preparedness and response strategies. Other strains such as Sudan Ebola virus and Bundibugyo Ebola virus also pose significant health risks. While they may not be as deadly as the Zaire strain, they can still cause severe illness and death. Each strain of the Ebola virus has the potential to cause serious illness, leading to symptoms such as fever, severe headache, muscle pain, and in severe cases, internal and external bleeding. Scientists believe that bats, are the natural reservoir for the Ebola virus. This means that bats carry the virus without getting sick from it, acting as a source of infection for other animals and humans. Bats can transmit the virus to other animals through their saliva, urine, or feces. When these animals come into contact with humans, the virus can then be transmitted to people. The virus can spread from bats to other animals, such as monkeys or antelopes, which can then infect humans who hunt or consume these animals. Humans can get infected through direct contact with the blood, secretions, organs, or other bodily fluids of infected animals. This is why it's crucial to educate communities about the risks and promote safe practices to prevent the spread of Ebola. Ebola spreads through direct contact with bodily fluids. This means that if you come into contact with the blood, vomit, feces, or other bodily fluids of someone who is infected, you are at risk of contracting the virus. The virus is highly contagious and can be transmitted even through small amounts of these fluids. This includes blood, vomit, and feces. These fluids are the primary carriers of the virus, and even a tiny droplet can be enough to cause an infection. It's crucial to handle these substances with extreme care, especially in medical settings where the risk of exposure is higher. It can also spread through contact with objects contaminated with these fluids. This means that medical equipment, clothing, and surfaces that have been in contact with an infected person's bodily fluids can also be sources of infection. Proper sterilization and disposal of contaminated items are essential to prevent the spread of the virus. The virus enters the body through broken skin or mucous membranes. This can happen through cuts, abrasions, or even minor injuries that you might not notice. Mucous membranes, such as those in the eyes, nose, and mouth, are also vulnerable entry points for the virus. These are found in the nose, mouth, and eyes. It's important to avoid touching your face, especially if you have been in an environment where the virus might be present. Simple actions like rubbing your eyes or scratching your nose can inadvertently introduce the virus into your body. You can also get Ebola through sexual contact with an infected person. The virus can be present in bodily fluids such as semen and vaginal fluids, and it can be transmitted during sexual activity. It's important to practice safe sex and use protection if you or your partner have been exposed to the virus. Ebola is not airborne. It doesn't spread through the air like the flu. This means that you won't catch Ebola from someone coughing or sneezing near you. The virus requires direct contact with bodily fluids to be transmitted, which makes it different from many other infectious diseases that can spread through the air. You won't get Ebola from casual contact with someone who is infected. This includes activities like shaking hands, hugging, or being in the same room as an infected person, as long as there is no direct contact with their bodily fluids. It's important to understand this to avoid unnecessary fear and stigma. However, it's important to take precautions if you are caring for someone with EVD. This includes wearing protective gear, practicing good hygiene, and following protocols for handling and disposing of contaminated materials. By taking these steps, you can help prevent the spread of the virus and protect yourself and others. Ebola symptoms usually appear 2 to 21 days after infection. Early symptoms can be similar to other illnesses. They include fever, headache, and muscle pain. As the disease progresses, symptoms become more severe. These include vomiting, diarrhea, and abdominal pain. Some people experience bleeding or bruising. This is a sign of internal bleeding. Ebola can also cause confusion, seizures, and coma. These are signs of the virus affecting the brain. It's important to seek medical attention immediately if you experience any symptoms of Ebola. Section 5. Diagnosing Ebola virus disease. Diagnosing Ebola early is crucial. It allows for quicker treatment and helps prevent further spread. Doctors use several methods to diagnose EVD. Blood tests are the most common way to detect Ebola virus. These tests look for specific antibodies or genetic material of the virus. Antigen detection tests are also available. They can provide rapid results. Doctors may also take samples of other bodily fluids. These include saliva, urine, and spinal fluid. These samples are tested for the presence of Ebola virus. Early diagnosis is key to improving chances of survival. Section 6. Treatment and management of Ebola. There is no cure for Ebola. However, there are treatments that can improve a person's chances of survival. Supportive care is essential for managing EVD. This includes providing fluids to prevent dehydration. It also involves managing fever and pain. Doctors may use medications to control vomiting and diarrhea. Experimental treatments for Ebola are being developed. These include antiviral drugs and antibody therapies. These treatments have shown promise in clinical trials. However, more research is needed. Section 7. Preventing Ebola outbreaks. Preventing Ebola outbreaks requires a multi-pronged approach. This includes controlling the virus in its animal reservoir and preventing human-to-human transmission. Vaccination is a key tool in preventing Ebola. There are effective vaccines available that can protect against the virus. Vaccination campaigns are crucial during outbreaks. Other prevention measures include avoiding contact with bats and primates in affected areas, practicing proper hygiene such as frequent hand washing, using personal protective equipment when caring for sick individuals, and safely burying the bodies of those who have died from Ebola. Section 8. The global response to Ebola. Ebola outbreaks require a rapid and coordinated global response. The World Health Organization, or WHO, plays a critical role in coordinating these efforts. When an outbreak occurs, the WHO works with affected countries to track the spread of the virus, provide medical supplies and personnel, and implement control measures to prevent further transmission. International organizations, governments, and NGOs also contribute to the response. This collaborative effort is essential for containing Ebola outbreaks. Section 9. Conclusion: staying informed and prepared. Ebola virus disease is a serious public health threat. Understanding how the virus spreads, its symptoms, and prevention measures is crucial for protecting ourselves and our communities. While outbreaks can be frightening, it's important to rely on accurate information. Staying informed and following the guidance of health authorities is essential. By working together, we can effectively respond to Ebola outbreaks and prevent future ones. Remember, knowledge is power when it comes to fighting infections.